afternoon, Ms. Brown. As you know, my name's student Dr. Kaitlyn Hall. These are my colleagues.
My name is Jared Eves.
I'm Veronica.
And we just wanted to catch up on the progress that you've had since the last visit when we discussed your diagnosis of Sjogren's disease. I understand that your symptoms, that you started having symptoms that we discussed, such as a dry mouth, dry eyes, dry vagina, and kind of review that this disease process is your body's immune cells attacking the organs that produce fluids, such as the saliva in your mouth, the tears in your eyes. And there is no cure for this, but there are treatments, which I understand that you've brought up a couple of treatments that you'd like to go over. Again, I do want to emphasize that there is nothing you did that caused this disease. Unfortunately, things like this happen, and I wish it didn't. But now that we're here, I'd like to discuss some of the treatment options you brought up, because we want to make this a partnership, do treatments that you would like.
Okay, so we have this up on the board, but I'm going to go ahead and give you a copy so that you can have a hard copy of it. And what I'm here to talk to you about today are the pros and cons of the traditional medication that we would go with for your syndrome. So normally for primary Sjogren's syndrome, we would go ahead and prescribe hydrochloroquine, and the pro to this is that it has improvements for some of the symptoms you've been having, as well as other cutaneous lesions, arthralgias, myalgias, and arthritis. A con to this medication is that it doesn't always work in every patient the way we would like it to. In this case, what we would do is we would go ahead and add methotrexate to the hydrochloroquine and treat with both. And it would again help with the symptoms you have been showing and with arthralgias, arthritis, myalgias, and other cutaneous lesions.
Okay, so now that we've talked a little bit about the traditional treatment and medications for the Sjogren's, specifically the symptoms that you're having right now, you did bring up the fact that you were considering some alternative treatments, some natural remedies, and that the one that you brought up was acupuncture. So first I just want to let you know a little bit more about acupuncture. I'm not sure how much exactly you know about it, but I kind of want to just give you an overview of what it is, and then give you some pros and cons, and then basically provide you with the ideas you need to make your own decision as far as whether or not to use the natural versus the alternative treatment. First of all, acupuncture is basically something used commonly in Chinese medicine, and basically what it is the acupuncturist will stick needles, very thin needles, non-painful needles, and different pressure points or different parts of the body that are known or believed to be associated with other parts of the body. So let's say, for instance, if I stick a needle in your nose, it might mean that I'm relieving a pain or pressure in your foot. So that's kind of the main idea of what acupuncture is. And there's a lot of studies out there that say that acupuncture does relieve pain, especially like lower back pain, muscle pain, joint pain. So that's basically the gist of what acupuncture is. As far as the pros for acupuncture, a lot of them are stress relief, and like I mentioned a while ago, the relieving of pain. But a lot of studies have shown that, as you can see on your paper there and on the board, headache reduction is one of them. And a lot of people claim that with acupuncture they feel like they have a lot of energy, high levels of energy after they do acupuncture. Another good thing about acupuncture is that people say that there's very little side effects. So those are the pros of acupuncture. Some of the cons, the fact that you're using needles always increases the risk for infection, and you are using a lot of needles with acupuncture, so your risk is greater. Also, as far as acupuncturists, there's seems to be different certifications based off like different states and stuff like that. So one of the cons is that you really have to know if your acupuncturist is really certified and knows what they're doing, because I'm sure there's a lot of underground acupuncture going on. And not only that, another con would be that a lot of people who do acupuncture say that it takes a long time to actually see results, and some people say that it didn't really help them at all. So those are some of the cons. As far as your specific case in acupuncture, I was looking up some treatment options for your Sjogren's and your specific symptoms. And one of them was acupuncture, but I did look at some studies, and a lot of studies find that patients claim to have no improvement in symptoms with Sjogren's compared to before and after using acupuncture, and this is a widespread thing. One of the studies I looked at, actually in the group of people that were in the study, there was 20 women and 1 man, and I think this study really fits you because you're a woman. So this study was represented women very well, and overall there was no significant correlation between the use of acupuncture and the improvement of symptoms. So those are some of the things you need to think about as far as acupuncture is concerned. So to kind of wrap everything up, we're just going to talk a little bit about, just kind of give you a brief overview of everything, and you have the paper. So you can either do the traditional route, which is what most people do, and you can use the hydrochloroquine in combination with the methotrexate. And this obviously does depend on the individual, because individuals do respond to medication differently. Then you have the acupuncture, which based on many studies has not seemed to work. So as a group, and all consulting with each other, we feel like it's the best idea to not use the alternative treatment. And that's not to say that you shouldn't do it at all. If you would like to use acupuncture, that's a great idea, but to treat the specific problem you have, acupuncture is not the best option. So we would suggest using the traditional route.
And also we would encourage you to go ahead and consult us with every alternative measure that you try, just so that we are sure that it doesn't interfere or cause a different reaction with our traditional treatment as well.
Right.
We want to make this a partnership. We don't want to force any treatment on you. We want to develop a treatment plan together. We've explained that the treatment we would like to prescribe addresses the antibodies or the immune cells that are attacking itself, whereas acupuncture is mostly to relieve symptoms, even though studies show that even that's for debate. Again, think about it for a little bit, and if you have any questions, please consult any of us.
Right.
We'd be happy to answer any questions.
Yeah, and we do realize this is a really long-term thing. Sjogren's is something you live with for the rest of your life, so we want to make sure that this is a long-standing collaboration and relationship. So if you ever need anything, know that we're here.